So one of my favorite time of the year, it is Christmas. Christmas is a time of music, time of hustle and bustle and celebrating, a time when we think of the birth of Christ, the baby Jesus and the angels. So in the program today, we're going to be listening to some beautiful music from a wonderful violinist from University of Montemorelos. I have two great doctors on the show with me that are so inspiring, I thought of bringing them. So I want to welcome you to Get Healthy with Dr. Cooper. My name is Dr. Cooper Dockery, and I've been practicing medicine for the last 27 years. So welcome, enjoy the program. Welcome to Get Healthy with Dr. Cooper.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Thank you. That was Mr. Duo Taddeo from Montemorelos. Now he has some CDs, and then you're going to be, if you'd like one, just inbox me and I'll send you the information. All right, so welcome Dr. Brown.
Thank you.
And Dr. Brown. Don't be shy. In the next couple of years, you'll be Dr. Brown. Of course, you know, medical students never like to be called doctors, but actually you have to get used to the doctor. You've worked hard for it. And Jeremy, I'm going to be picking on you first.
Okay.
Tell me a little bit about yourself. Where are you going to medical school?
I'm a second-year medical student at Baylor College of Medicine in Houston, Texas.
Right. And I know you had a tremendous first year. I have been following you on YouTube. All right, you have a channel there.
Yeah.
And I know you have done very well. Tell me, during your first year, what were you asked to do in addition to studying? Were you a teacher there? Were you a tutor?
Yes. So during my first year, I think the beginning segments of it were just very difficult, trying to adjust to how much they wanted us to study, the volume of information that they wanted us to absorb at such a quick rate. But once I sort of got the handle of that, I sort of started to pick apart what I like to do, and an opportunity presented itself to be an anatomy tutor for the incoming first years. And I really love anatomy, and I've always had a passion for teaching since college, so the two really mesh together.
Very
quite
good.
nicely.
What do you think I brought you to this program? Not to discuss entire medical school. Do you think I brought you there? Jerry, you have been a model young man, and I know that you're going to be a successful doctor. But while I was planning this program, I was looking for doctors that play. I really wanted doctors or medical students to play on my show. You chickened out, but that's all right. You opted for the interview. And I tried to videotape your church yesterday so I could put that on, but I failed.
No.
So I know you did very well. You have done marvelously well. And you know, this is a season where we give gifts, we say thanks, we think about Jesus Christ who came as a babe, lived an exemplary life, and then he's going to come back. He was a servant. And there's one thing I admire about you. You're always willing to serve. A couple of months ago, I think you found yourself in Houston after the flood. Tell us a little bit about that.
Oh, so that was quite the experience. I'd never been in a disaster like that before, where entire communities are destroyed. The streets look like rivers, boats are in the street. So I just knew when I saw that, right after the storm had passed in the morning, I knew I had to go and do something. So I took the next couple of days, an entire week actually, just to volunteer at various homeless shelters and help clean out whole communities and houses for people, help them relocate, and that was an amazing
Well, it's a big
experience.
heart, really.
Yes.
Medical student taking off a week to go serve the community? That's a little unheard of, because studying medicine is a challenge. But you have done very well, and I just want to commend you. Now, before I continue with you, Jeremy, I have a very special lady beside me here, and Dr. Lisa Brown, tell us about yourself. What is your area of emphasis? Where you're currently working?
Okay, so hello, my name is Lisa Brown. I recently finished my fellowship in both geriatrics and palliative medicine in Texas, in San Antonio, Texas, and I recently moved to Maryland, Annapolis, Maryland. I'm working at a hospital called Anne Arundel Medical Center, and I'm actually practicing inpatient palliative medicine there. A lot of individuals don't know what palliative medicine is.
Yes.
So it's a growing field. It's essentially a field where we care for individuals with life-limiting illnesses, and we help them with various symptoms. So physical symptoms, we do a lot of pain management, nausea, vomiting, etc. Spiritual and emotional pain as well, those symptoms. And our main goal is just to make sure that individuals live the best quality of life possible for whatever period of time they have left.
So you're double board certified or triple?
I will be eventually triple board certified.
Wow. This young girl is triple. Is going to be triple board certified? Family medicine.
Family medicine,
What
palliative
else?
medicine boards,
All right.
and then geriatric medicine.
Very
boards,
good.
yes.
And if you joined us at the beginning of the program, you realize that Lisa is very talented. She just played the piano. Lisa, apart from working with your patients, what else do you do? Do you have a church community, and are you very active there?
So I have found a church community. I'm working to become active in that church community. The church is a bit of a ways for me, but I enjoy it, and I join the young people, so I'm working to, yes, get more involved in that community.
Very nice. Very nice. Now, this show is a show that is designed to discuss lifestyle medicine. It's a growing field. And most of our chronic diseases, now we are starting with lifestyle medicine as the #1 treatment option, and then we add medicine to that. I'm going to ask Jeremy. you're in your second year of medicine. What do you think, how would you place lifestyle medicine in your future practice? It's a simple question.
Overall, I think I do agree with you about how lifestyle medicine is being brought to the forefront of our field as time progresses. We've kind of gotten ourselves stuck on the one cure all sort of mentality where, oh, I have a problem, let's see if I can just get some medication for it and solve it. But if we can get ahead of that and primarily treat the issues that would cause the disease, then that would save a lot of people a lot of pain, a lot of financial problems as well. And nobody likes to lose their health. So I think in future practice, it would probably be the first thing that I go to.
Right, getting to
when
the
discussing
root
that
cause
with my
and
patients.
solving that rather than just adding a band-aid to the problem, right?
Absolutely.
I think you're a smart, wise guy.
Oh,
I think we're going to take a break and we're going to go back into music with Mr. Talio from Montemorelos. beautiful. Thank you. Gracias. Háblanos acerca de usted tantito. ¿Dónde está trabajando ahorita?
Estoy trabajando en Montemorelos, Universidad.
So I asked him where is he working. He's working in Montemorelos University. ¿Qué hace ahí usted?
Soy profesor de violín.
So I asked him what he does. He's a professor in violin.
Y estoy trabajando en la Orquesta Sinfónica de la Universidad Autónoma de Nuevo León en Monterrey.
And he works in the Symphonic Orchestra in Monterrey. ¿Usted tiene cuántos años tocando?
No más que 30 años.
I asked him how many years has he been playing? Over 30 years. Do you have this music on CD? ¿Tiene esos música en CD?
Sí, sí, tengo música navideña y tengo otro CD, mi tributo, donde son himnos cristianos.
So he has Christmas CD as well as just general Christian CDs. So if you have interest in listening to this wonderful and beautiful music, then please inbox me, send me a message, and I'll get you the CD. Los precios de los CDs.
De navideño, $10 y de mi tributo, $15.
So the Christmas CD is just $10, and the My Tribute CD, that's just $15. $25 for two beautiful CDs. I purchased these CDs last night. Wonderful. Gracias.
This is what high blood pressure looks like. Talk with your doctor to create a plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
Dr. Brown, Lisa Brown, she's board certified in family medicine as well as palliative medicine. And then Jeremy Brown is a second-year medical student at Baylor University School of Medicine. Lisa, palliative medicine.
Yes.
People will hear of family medicine, internal medicine, oncology.
Yeah.
Talk to us a little bit more about palliative medicine, why you recommend that if someone is sick and in their last stages of life, they probably should be in palliative care.
So yes, so palliative care, like I mentioned earlier, is a growing field for individuals with life-limiting illnesses. So we actually recommend that even if you're at the beginning of that life-limiting illness, that you get involved in palliative care. A lot of people are under the assumption that it's just hospice, but it's actually a lot more than that. And I feel as though and individuals in palliative medicine feel as though when you get on it at the end of your illness, you don't really get the full benefits. So if you have a life-limiting illness, cancer, COPD, congestive heart failure, COPD is chronic obstructive lung disease, any other illnesses that will limit your lifespan, we recommend that palliative care be involved. We have medications that can help with your symptoms. For example, if you have chronic obstructive lung disease, you'll eventually become very short of breath. We have medications that can help with that. With cancer, individuals have their cancer spreads to different parts of their bodies. We can help with pain, with the nausea that comes with that. And then we provide supportive care for you and your loved ones throughout that period of time. And of course, if it comes time where, medical management cannot cure your illness, then of course it'll be hopefully an easier transition to end-of-life care or hospice. And because you've been involved at the beginning and throughout, the course of that illness, it's a bit of an easier transition. Never easy in general to recognize that, the end of your life is coming, but it helps that you've had the support and to help to realize that that's where you are.
A lot of my patients, when I mention palliative care or hospice, they think, are you saying I'm dying right away? I don't want that. So I think we have to educate the community that this is something they need because it's supportive care. There are multiple team members to help the family members care for these patients who are that chronically ill. Am I right?
Yes, you're right. It's an interdisciplinary team. So we have physicians, we have nurse practitioners, social workers, chaplains. All of these individuals are part of the team and help to support the patient and their family.
Very nice. Let me take some time here to welcome some of my viewers. Brother Boxhill from New York, welcome. Please like and share. We have beautiful music for you. My cousin Pauline Hogg from England. Hi, Pauline. Welcome. Patricia Torres, my patient. Welcome. Miss Daniak, welcome. Please like and share. We have beautiful Christmas music for you. And I'm here with two lovely, lovely, lovely doctors and Dr. to be. I've watched these young people grow up. They're like my children. So I'm so happy to be sharing the stage with them tonight. Jeremy,
Yes.
you hear your sister talking about palliative care. What are you thinking about medicine? What area would you like to pursue after medical school?
Well, I start my clinical rotations this year, so things might change. But so far, my top two choices are going to be pediatrics or emergency medicine.
Nice.
Yeah,
Nice.
those are very interesting.
Pediatrics.
Yes.
Why pediatrics? I know Lisa wanted to do pediatrics.
Not
And over
anymore.
the time that is gone, that went away. So why peds?
Peds is a very interesting and can be a very fulfilling field, mainly because you're not just working with one patient, but you're working with the patient as well as the family. Children also have this amazing ability to bounce back from things. So they can get sick very, very quickly, but they can also recover very, very quickly. And that vitality is extremely interesting and extremely powerful. And when you're working in peds, you have the opportunity to not just shape somebody's life at that moment or for the time that you're treating them, but you give them the opportunity to have a full, long, and healthy life.
You know, Jeremy, I was speaking with my daughter, Donnell, because she's currently doing pediatric, but she just ended. And she told me the exact same thing. Mom, I'm thinking I want to do peds because I have the opportunity to touch the child's life and shape the life forever, in quotation mark. And also, I can also help the family. So you guys are on the same wavelength. I really admire that. All right. You know, I have been practicing medicine for 27 years, internal medicine, but I do like working with the family. As a matter of fact, I also see patients at home. When I go to their homes, then I am in their intimate space that I can touch their life in a very different way. I remember one Saturday, rather than going to church, I went to several patients' home just to minister to them. And that brought me so much satisfaction. You see, when you're in medicine, you have the opportunity not only to touch the physical life, the physical aspect of the person, but the spiritual, the mental. And as you continue in your path, Lisa, and as you start, Jeremy, we have to think of seeing medicine in a holistic approach. You know, many doctors spend time thinking about the physical. Okay, so you're here for cough and fever. I think you have bronchitis or pneumonia. I'm going to treat that. But sometimes you have to listen to the patient, listen beyond the symptoms, and get to the actual cause. Is that patient depressed? What's going on? Is that patient eating healthy? Is that patient exercising? How is the immune status? How is the home situation? When you touch the patient's life in that holistic approach, then I think you're having a more lasting impact on changing lives.
Absolutely.
All right. So Lisa, tell me what your day is like, a day in the life of Dr. Lisa Brown.
A day in the life of Dr. Lisa Brown. Well, I wake up, get ready for work, maybe wake up around 6 o'clock, leave the house around 6:45, get to work at 7. I have 4 nurse practitioners that work with me, so I make the list, I print out the list, and I assign who is seeing which patient. And then I basically prep my patients, so whoever I'm seeing, I look through, their chart, see what their temperature and their vitals were overnight, what their pain level was, how much pain medication they used over the past 24 hours, if there were any changes that were noted by the nurses or what other consultants might have written in their notes. Then I go and see the patients. That usually takes the majority of my morning.
Do you see them in the hospital?
In the hospital, yes. I'm in the hospital setting.
Oh, okay.
And then we get consults in from, the primary physicians. And so when we get those consults, I divvy them up to individuals, and then, of course, I'll do I get patients as well. And so I see those patients. And so it's kind of just seeing the old patients, seeing the new patients.
Okay.
Yes.
So you're kind of new at the job.
Yes.
Tell me, when you started that job, Did you have any difficulty? What was the transition like?
The transition was a bit difficult. I had just come out of training, a couple months prior. I was supposed to have a mentor that was to help me, to guide me in that process, because I'm also in a leadership position, and she was kind of to help me in that position. And so when I got there, I was under the assumption that she was just on vacation for a few weeks, but it turns out that she is ill. And she's supposed to come back every month. It wasn't coming back next month and the next month, and it just kept getting pushed back. And now it's January.
Oh, so and she's not back?
No, she's not back.
So you had to kind of figure your way out?
Yes, so I had to figure my way out, talk to different individuals. The team members didn't know that I was supposed to be the leader of the team, and so that caused some friction as well.
Oh, my Lord. How did they see you as a young grad? You look very young. I know you are young. Did you have a problem there?
I don't know if that's what it was, or maybe they didn't think that they should be taking direction from someone who looks so young and who was just out of training. But we've, things have smoothed out at this point in time, I think.
And you're enjoying yourself?
Yes, for the most part. Yes.
Good job. Let me take some time to welcome some people here. Jennifer Lynch, I don't know where you're watching us from. Welcome. Marjorie Smith, welcome. Mr. Gordon from Jamaica. Welcome from Jamaica. All right, Harry, welcome. Zelda. I see your aunt here, Paula Chang. Oh. Guys, say hi to Paula. Hi. Ralph Flores, thank you. Please like and share. I have two amazing young doctors here. Hi, Leroy from England, my cousin Sharon, welcome. We are just talking here easily with two young doctors. Dr. Lisa Brown, she works, what's the name of your hospital?
Anne Arundel Medical Center in Annapolis, Maryland.
Right. And then Jeremy is a second-year medical student at?
Baylor College of Medicine in Houston, Texas.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website www.cooperwellnesscenter.com.